So welcome everyone to the Surveillance Advances Seminar Series. Bienvenue to Le Monde. We are delighted to launch this seminar series with today's event. My name is Luisa Arroyave. I'm a postdoctoral fellow at the National Collaborating Center for Infectious Diseases, or NCCID for short. I will be your moderator today, along with Louis Won. Louis is an acting manager in the Corporate Data and Surveillance branch of the Public Health Agency of Canada. This virtual event called Bridging the Gaps, a vision for public health surveillance in Canada, is the first of the seminar series that will be co-hosted by the Public Health Agency of Canada and NCCID. NCCID is funded by the Public Health Agency of Canada to provide evidence and knowledge for use in public health planning, programs, and policies related to infectious diseases. We are very pleased to be co-hosting this series with the agency. I would like to acknowledge that NCCID is hosted by the University of Manitoba on the original lands of the Anishinaabe, Cree, Ojibwe, Dakota, and Dene peoples, and on the homeland of the Métis Nation. At NCCID, we strive to honor the lands and their original caretakers in our work. We acknowledge that we are on Treaty 1 land. We recognize that these and other treaties have been implemented as part of the process of colonization intended to benefit some while harming others. We are committed to working with other partners toward reconciliation. So we will also like to know that Surveillance Advances is a self-approved group learning activity as defined by the Maintenance of Certification Program of the Royal College of Physicians and Surgeons of Canada. The seminar series is also approved by the Council of Professional Experience for Professional Development Hours for members of the Canadian Institute for Public Health Inspectors. And if you require a letter of participation for this seminar, please look out for a survey that will be shared after the seminar. So I will now give the floor to you, Luis.
Good morning or good afternoon, everyone, and thank you, Louisa, for covering some key housekeeping items. And welcome, everyone, to Surveillance Advances. Bienvenue tout le monde. Today, I am wearing my favorite turquoise square glasses, along with a dress shirt with flowers and light blue fleece jacket. Some would say I have fluffy black hair. While today's seminar will be delivered in English, we welcome everyone to pose their questions in their language of work. I would like to begin by taking the time to acknowledge the land that I live and work on is the traditional territories of the Wendat, the Anishinaabe, the Haudenosaunee, Métis, and the Mississaugas of the Credit First Nation. It is home to many First Nations, Métis, and Inuit people. I'm grateful for the opportunity to share their home. Today, we have participants and presenters joining us from coast to coast to coast. The land in which they and you join us from represent the lived experiences of many Indigenous people, all with their own unique health story. As a public health practitioner, I will continue to challenge my way of thinking and practice to ensure that the work that I do provides space and opportunities for Indigenous people to tell their stories and to highlight their strengths and successes. Furthermore, we would like to acknowledge that the practice of public health surveillance may raise concerns for Indigenous peoples and other communities. To public health professionals, surveillance sounds similar to epidemiology, which is about understanding the distribution and patterns of determinants of health and diseases in populations. But for others, surveillance may carry negative connotations about security, privacy, and control. For this seminar series, we would like to note that we use the word surveillance to refer to the assessment of and response to public health threats as a core function of our public health systems. Before moving on to our presentation, I would like to share that the Corporate Data and Surveillance branch is now called Data, Surveillance, and Foresight branch. The branch will continue to lead the integration of public health data, surveillance, and foresight needed to better anticipate, detect, understand, and act on the greatest public health threats facing people in Canada. Today's topic is one that I am excited about. The Public Health Agency of Canada's work to develop a vision for public health surveillance that will be informed by today's discussion, by public health partners and stakeholders, and by lessons learned from the COVID-19 pandemic. This vision will prompt forward thinking to keep our surveillance systems relevant and responsive to future public health needs, from infectious diseases to chronic conditions, data science to health equity. This seminar series is a space to bring us together to explore the most pressing public health issues of our time. Moreover, this seminar series is not just about the speakers and organizers, it's about you, the audience. Your active participation, questions, and perspectives are vital to the success of this initiative. We encourage you to actively engage in discussions, ask questions, share your thoughts, and foster collaborations that can lead to improvements in public health surveillance. On that note, we would now like to introduce and welcome our speakers for today's seminar. Dr. Yoav Keenan is the Scientific Director of NCCID. He is also an Associate Professor at the University of Manitoba. He is a clinician scientist and an infectious disease consultant with the Winnipeg Regional Health Authority and the Manitoba HIV Program. Dr. Keenan's research focuses on immune and genetic determinants of immune activation and the role they play in HIV acquisition, progression, and end organ dysfunction. Other areas of his research revolve around early markers of TB acquisition and determinants of susceptibility. Dr. Keenan's project relies on both local and international cohorts with growing collaboration in Colombia. Welcome, Dr. Keenan. Next, we have Dr. David Buckridge. Dr. Buckridge is the Executive Scientific Director of the Data, Surveillance, and Foresight Branch at the Public Health Agency of Canada. He is also a professor in the School of Population and Global Health at McGill University in Montreal. Dr. Buckridge holds other key leadership, advisory, and consulting roles for local and international organizations, such as the McGill University Health Center and the World Health Organization Epidemic Intelligence Forum Open Source Program. Welcome, Dr. Keenan and Dr. Buckridge. We are pleased to have you join us today, and we are excited to learn from both of you. So by the end of this seminar, we hope that all of you here today will be able to understand the foundations of public health surveillance, including their importance in addressing public health threats and promoting population health and well-being, describe current gaps and future opportunities for public health surveillance in Canada, and discuss how you can contribute to the development of a vision for public health surveillance in Canada. On that note, I would now like to invite Dr. Yoav Keenan, who will be our first speaker. Welcome, Dr. Keenan.
Thank you very much for the introduction, and thanks for the organizers and the staff of Public Health Agency and the staff of the NCCID that brought together this webinar series. And hopefully it will be an enjoyable conversation on the future of surveillance in Canada. Next slide, please. I have no conflict of interest to declare that are relevant to this presentation. Next slide, please. So this is the first polling question, and it is for all of you to reflect on in few words. If you could describe what are some of the public health surveillance and what does it mean to you? So I'll wait a couple of seconds to see if people put in some of the words that come to mind as they reflect on what public health surveillance means to them. Jonathan, is that enough? I can't see any of the responses at the moment. Okay, I don't see the response, so I will proceed to the next slide, please. So the definitions of public health surveillance, which I'm sure many of the words came in your responses that I couldn't see, are the continuous systemic collection, analysis, and interpretation of health-related data that is essential for planning, implementation, and evaluation of public health practices It relies on prompt dissemination of the results to those who need to know. And it is particularly important to manifest those information to people who are in position to take action to affect public health. Next slide, please. So public health surveillance is a core function of public health system, and its importance cannot be overemphasized, and the generation of the data and information that is needed to detect and to understand trends in health conditions. And that understanding of the epidemiology is really essential in protecting public health. And without relying on solid data that is gathered in a timely manner, analyzed and disseminated back, it is impossible to make evidence-informed decisions that prioritize resources to where they should go in order to prevent and promote health. Next slide. Surveillance is one of the 6 core public health functions, and obviously it is a key tool for guiding public health actions. It is essential and critical in planning resources and allocation to programs. And without understanding the granularity of the data and without timely analysis of the data, resources there's a chance of resources not being allocated to areas of the greatest need. And I'll go more into that as we will go a bit deeper into some examples where these things are not happening in a timely manner and what could be some of the consequences associated with it. The quality of data and how data is disaggregated is critical to guide the development of policies, and it is important to understand that policies, not only health policies, but health in all policies, need to be guided by strong data and granular data that allows to understand what are the processes that underlie the differences in burden of disease among specific populations. And therefore, that is critical in addressing those gaps and those inequities and directing resources to where they're needed most. Next slide, please. The National Collaborating Center for Infectious Diseases that Luisa introduced to you earlier has worked in many areas related to infectious diseases, but our work on surveillance over the past 10 years revolved around surveillance of antimicrobial resistance and antimicrobial use, including taking some One Health approaches. And this is one of the areas where we applied One Health approach, but it's definitely relevant in other portfolios within the infectious disease portfolio. Tuberculosis surveillance, where we are working to try to promote indicators in the data that is collected and basically indicators that prioritize equity. We worked in respiratory viruses and respiratory diseases, including the swine influenza and the surveillance of other influenza of potential concern as emerging infections. We work at broader areas of emerging infectious diseases surveillance. And in all of the areas where we work, equity is one of the lights that the constant threads of work that shines through our portfolios. We worked in HIV surveillance and STBBIs, where we focus a lot of our attention on some syndemic conditions. And in the past few years, we delved into big data and the opportunity that it provides in terms of surveillance. We implemented some of those in understanding the impacts of flight connectivity during COVID-19 epidemic evolution in Canada. Next slide, please. The NCCID also conducted a review and consultation with key stakeholders to try to understand some of the difficulties and the barriers and opportunities that exist within public health surveillance in Canada. And some of the main findings include that the data is heterogeneous and it is the result of a federated system that has issues with the data collected, the case definitions that vary according to jurisdictions and lead to difficulty in converging data and analyzing it on a national scale. The systems that collect and the surveillance data are different across jurisdictions, and they lack interoperability, and that burdens and cripples the ability to compare health data. The coverage of surveillance activities is unequal, and there are inequities in the coverage and the scope of surveillance between jurisdictions, and when you move from northern to more urban southern parts of the country. So there is a gradient in the availability and the quality of surveillance data. And one of the quotes was that the system is fractured and has many lines of breakage. Next slide, please. Other weaknesses and gaps that were identified by surveying key stakeholders include the lack of timeliness. In many of our reports, we don't get the report until more than a year later. If you look at national reports for our tuberculosis and STBBIs as examples of lagging information. The resources that are dedicated to data information technology are insufficient. And this is one of the areas that has been flagged repeatedly as an underinvested area in public health. And all of those issues that I've already mentioned result in data that is collected that lacks granularity, and the disaggregation of data at a national level because of the various barriers that I've already mentioned leads to decreasing number of data points and data becoming less granular. An example for that is in the TB portfolio, tuberculosis, where we've seen a diminishing number of indicators over the past 15 years, as highlighted in an excellent paper by Jonathan Campbell from McGill, that basically lead to data that doesn't help in public health action. Next slide, please. One of the other main issues is the lack of granularity of data and disaggregation, that it doesn't allow us to unmask some of the inequities that occur, and doesn't allow to identify areas and populations that need to have more resources dedicated to decrease burden of disease. The risk of that is that it may lead to further entrenching or enhancing inequities. And that requires particular attention for disadvantaged populations and the disaggregation of data is going to be important in achieving or allocating resources to a resolution of some of those inequities. Next slide, please. The gaps also are in the way data is collected. There is a risk of enhancing stigmatization, and there's always a concern of confidentiality and data protection when information, especially from smaller populations, is shared, especially if shared across the boundaries of jurisdictions. Next slide, please. We learned many lessons and found many opportunities for public health surveillance in the setting of COVID-19. Timeliness of surveillance was inadequate, but there were attempts to harmonize data. And again, the lack of interoperability of the data systems represented a major challenge. The investment in technological infrastructure is insufficient, and if you contrast it to how much was invested in testing technologies during the pandemic, you can see the gaps. We invest a lot in the techniques to test for specific pathogens and less in the technologies to collect data and analyze it and disseminate it in a timely manner. Next slide, please. Public health financing is insufficient, and it impacts the quality and the ability to disaggregate data for surveillance. And the focus on One Health is insufficient across the portfolios. Surveillance systems don't capture the socioeconomic factors and the social determinants of health, and that is a major thing that I'll focus on in the next few minutes. public health should address and adjust to infodemics. So the fact that there is a plethora of information of dubious quality and evidence base available to everyone on their devices, that it presents a problem, but also an opportunity to fill that gap with quality data that relies on disaggregated data from surveillance. And as I've already alluded to, coverage is not equitable across Canada. Next slide. The challenges are also the face of changing surveillance and over the past 2 decades with emergence of new diseases and new health threats. There have been changes in the data governance norms and emergence of new data sources that are publicly available, including development of data mining and analytical technologies that enhance our ability to timely collect and analyze information and present it in a way that is useful for decision makers. Next slide. There are opportunities, and I picked an example where we can use, and climate change is something that is obviously going to affect all of us, and it is already affecting all of us. And it's an example where we can develop models for surveillance where the interest is in emerging infectious diseases as an example. And those are going to change with the expansion of range driven by environmental changes, new interactions between wildlife, domestic animals, and humans, and species range that is changing. But most importantly, the range of humans is also changing. And that has been clearly illustrated in diseases such as dengue, leishmaniasis, and tick-borne encephalitis, as well as West Nile. Next slide, please. What can we do to better be prepared to surveil some of the information related to climate change? Is to have indicators of historical burden, to continue to have warning surveillance systems that are based on specific pathogens, to develop methods to evaluate interventions and mitigation strategy, and to apply new data sources such as the untapped citizen science, an example that has been used in Italy and in Spain for detection of mosquito species, such as the introduction of Aedes japonicus in Spain. And that is one way where citizen science can implement and complement the data that is available in traditional surveillance systems. Next slide, please. Examples such as climate change demonstrate the need for surveillance systems that are functional and collect information during and before the next pandemic, as we are likely to be unable to predict what will be the next pandemic that will come upon us. We need to have surveillance for what are the threats, what are the hazards, what is the exposure, who is vulnerable for developing diseases, and what are some of the equity indicators of a population. And that is really important when we look at respiratory illness. If we understand population mobility, understand who's most at risk, and have some data on equity, we can predict where our resources need to be allocated and not wait for a specific pathogen to introduce itself with the delays associated with the identification, development, or diagnostic tests specific to the pathogen. Next slide. So population displacement, for example, occurs as a result of climate change with fires and floods, and individuals are exposed to changing hazards of waterborne diseases, respiratory illness, vector-borne diseases, as well as sexually transmitted pathogens because of new human interactions. All of those have an opportunity for surveillance, not at the level of the pathogen, but at the process that leads to displacement and the displacement itself. Those displacements put individuals that were at risk to begin with at higher risk because of the lack of access to preventive medicine and harm reduction, for example, results in poor mental health conditions and poor health outcomes. That has been extensively reported in the literature. And if we don't address those equity issues and issues related to population mobility, we will not have good enough data to have a timely response when a pandemic occurs. And the hazards disproportionately affect people who are poor, who are more rural, who are precariously housed, and are not assessed by systems designed to identify specific pathogens. So we need some component of our system to address and surveil poverty, houselessness, food insecurity, and others. Next slide. This is taken from a recent paper at Lancet that looked at a new way of looking at surveillance, which tries to not go at a specific pathogen, but to assess the interactions of animals, humans, and environment in producing risk, but also to measure the hazard that the constellation of those endemic conditions presents, to assess the vulnerability and to identify populations who are at more risk to be exposed to whatever the next health condition that we want to look at, including emerging infections, and then to assess the exposures and try to have a system that surveils all components, including those social and structural determinants of health. Next slide, please. And that comes to what they proposed, the authors of that paper, is that indicators should monitor, for example, in this context, climate-sensitive infectious diseases, have projection for the risk for different adaptations and mitigation scenarios, provide seasonal predictions targeted at early warning and response system, evaluate local interventions, and identify new streams for surveillance. But most importantly, which I'm trying to hammer in this conversation, is that social determinants of health, social inequalities, and vulnerable groups should be identified prior to emergence of new threats, because those will allow us to allocate resources adequately. Next slide, please. I'll summarize here before handing over to my colleague, Dr. Buckridge, is that surveillance systems currently don't collect the same information, and the platforms are not compatible for communication across jurisdictions. Systems measure specific conditions and specific pathogens, and investment in information and data systems is short and insufficient. Coverage is not equitable across our vast land, and measures of vulnerability or equity, the systems must measure social determinants of health and to guide resource allocation. Next slide. This is my last slide, and there are opportunities to harness data that exists outside the healthcare and public health systems. Citizen science and mining of publicly available data may have good return on investment. Climate change can be one example where we exercise in the development of surveillance systems with equity in the front and center and surveillance of determinants of health in mind, rather than focus on developing more technologies to detect specific pathogens and diseases. I think this is my last slide, and I'm looking forward to the conversation that will ensue.
Thank you so much, Dr. Keenan, for your very thoughtful presentation and for covering some of the key principles as relates to public health surveillance. And I would like to note that your presentation also sets us up well for Dr. Buckridge's presentation, which is going to be focused on building a vision for public health surveillance in Canada. As noted in the chat pod, we do encourage you to include any questions that you may have for both of our speakers via the Q&A pod. And on that note, I'm going to pass it over to you, Dr. Buckridge.
Thank you very much, Louis, and thank you very much, Dr. Keenan, for that excellent presentation to get us going. And I'm going to talk now about efforts to develop a vision for public health surveillance in Canada, which we're calling Public Health Surveillance 2030. Next slide, please. So given what you've heard already from Dr. Keenan about the critical role that public health surveillance plays in public health, it comes as no surprise how importantly public health surveillance is taken at the Public Health Agency of Canada, where we see it's important for us to provide national leadership and also work very closely with the many stakeholders involved in surveillance across the country, with provincial and territorial and many other levels, that really allow us to do the work that surveillance is intended to do, which is detect, understand, and act on public health threats. Within the agency itself, we operate over 60 distinct surveillance systems, which themselves have seen many important advances and innovations over time, before the pandemic, during the pandemic, and of course, are continuing to evolve. And it's in this context that the Public Health Agency is building a foundation for ambitious future state for public health surveillance within the agency, but also in a way that we hope will hopefully paint a picture that will be important for all of our partners in the country that participate in the broader Canadian surveillance ecosystem. Next slide, please. So I'm sure as many of you are aware who work in public health and work with different surveillance systems, there actually has been a fairly rapid pace of innovation in surveillance over the last few years or decades. And that has come in many ways, both in terms of the technology, but also in terms of the way that the general public interacts with surveillance systems. And this is where we've seen increased expectations of transparency and also access to information and clarity about how data are being managed. Also, we heard a little bit about the citizen scientist movement from Dr. Keenan, but we have increasing demand from people to be able to get access to data, understand how decisions are made in the context of surveillance. It's also increasingly this, again, another important point is that we really want to be able to get into the issue of disaggregating data, and systems have been trying to push in that direction so that we have a better view on issues that are so critical, such as health equity. And then, of course, there's been the need to bring in new types of data, new technologies, new infrastructures, and new methods like mathematical modeling and new statistical tools and artificial intelligence. So this is an area where systems have been working for many years and surveillance programs to try to transform and to move forward in terms of the way that we do surveillance. Next slide, please. And of course, even though we continue to try and adapt and respond to these opportunities and changes, things continue to change. And here I'm just highlighting 4 broad areas where we expect to see continuing change. Digital transformation obviously is critical within the healthcare system broadly and in public health, and specifically in surveillance. This is something where people often think about a technology, but really it's about an organizational change and process improvement perspective. Something that I think is really critically important across the whole public health enterprise, but obviously very important and will continue to be in surveillance. The pandemic has highlighted the importance of global health. We've always known that to be the case, but we're very connected. I think the One Health perspective that was mentioned also by Dr. Keenan is very related here to understand this broader perspective. That will only continue in the future. New sources of data, there are increasingly new ways of generating data, of accessing data. And these are opportunities for surveillance, but it's also a question of what kinds of data do we want to integrate into our systems? Is it worth the effort? Does it improve what we're actually doing? We want to be careful that we're keeping our eye on the goal of surveillance and not necessarily chasing the latest data source or technology. And there are many new technologies. So, we've talked a bit about already some approaches to different mathematical modeling strategies. Increasingly, we're seeing new methods from artificial intelligence, ChatGPT type systems that can not only generate large amounts of text that might ultimately feed into surveillance, but can also be used to process those texts. And so there really are changes across multiple fronts that we expect to continue into the future that will be highly relevant to how we conduct public health surveillance. And we will have to make decisions, how do we incorporate those things into surveillance? Next slide, please. So all of this leads to kind of a question of, where are we headed? And I think, we heard a number of challenges and problems from Dr. Keenan's talk that we cannot ignore and are important to recognize. It's also important, though, to understand that we have had a number of, I would say, successes in how we do surveillance in Canada. Things are broken, but it's not as if we don't have anything there. We have obviously a lot of really highly skilled people with lots of experience in the country, a lot of infrastructure, some of it outdated, certainly. But we want to make sure that we build on what works, both in terms of the relationships and successes prior to the pandemic, but also we learned a lot during the pandemic. And we'd like to think about, in a more clearer way, where do we want to go? What should the future look like? And we want that perspective of the future, wherever possible, to be based on the best available evidence, the expertise that all of the people in this country bring to conducting surveillance, and also different approaches. And I've just listed here on this slide a few examples of things that we want to make sure that we're sort of baking into or considering quite carefully any future of surveillance, some of which we've heard, I think, mentioned as well before. Issues of health equity need to be central to any future that we see in surveillance. We want to make sure that we're taking that broader perspective, which I think, again, you heard Dr. Keenan lay out quite nicely in terms of going beyond single disease and having that One Health perspective. We need to demonstrate leadership in data governance and stewardship so that there is trust and confidence in how we conduct surveillance and transparency in how we conduct surveillance. And we do, as I said, just or alluded to earlier, we want to make sure we're making effective use of new technologies, new data sources. We don't want to be chasing the new shiny thing, but we do at the same time want to make sure that if there are important advances that will really improve the efficiency and the effectiveness of surveillance, we want to make sure that we are building up the evidence for how they should be used and incorporating them appropriately. So there's a lot to think about in terms of where we're going in the future. Next slide, please. And so this has really led us to want to drive this effort to develop a vision for public health surveillance in Canada. And that vision is really about what public health surveillance should look like, what we think it will look like if it is functioning well. And that needs to be informed. Obviously, the Public Health Agency needs to weigh in on our perspective on that, but it also needs to be informed by the many stakeholders in the broad Canadian public health surveillance ecosystem, recognizing that this really is an activity that is done by many partners, many stakeholders, and has impact on really all Canadians in terms of the work that's being done. So having this vision is important because it ensures that we can maintain the relevance of surveillance systems, and they can be forward-looking in the sense that we're not always trying to be reactive to the problems, that we're trying to look ahead, be responsive to future needs, appropriately incorporate new technologies and new methods, and if we develop this vision together, which is the plan that we would like to do this in terms of collaboratively with partners across the country, then hopefully we can have a shared North Star, as it will, that will allow us to start to build elements of the ecosystem towards some common objectives that would be fundamental to this vision of the future. Next slide, please. So, to give a little more structure into what I'm talking about here, this vision is going to describe the characteristics of a high-performing, responsive public health surveillance ecosystem. And I use that word ecosystem to really reflect the fact, as I said before, that although there are multiple different surveillance systems being operated at different levels within the country, at the federal level, provincial, municipal, and other locations, in many ways they should interact in this, or be interoperable, I think is perhaps an even more better term to use, that they're working towards a common purpose. They may not all exchange and interchange data and information, but they should be working towards a common framework in terms of how surveillance is done. We also want the vision to demonstrate how within that ecosystem insights are driving action. And so I think we heard also about challenges with timeliness of surveillance and how the information is communicated. We want to be able to paint a vision of, if this is working right, what should that information flow look like? How do we want the outputs of surveillance to drive action? And as I mentioned before too, wherever possible, we really want that description of our future state of what we want surveillance to look like to be based on science, evidence, and input from communities and real-world examples. And where we don't have evidence of what we should be doing, that's an important point too, and that becomes an agenda for applied public health research to try and close the evidence gaps that are critical to improving surveillance. And so all this together means that we're able to hopefully articulate at the end of this process, which we anticipate being able to deliver this vision early in 2024, we want to be able to articulate a possible future state for surveillance, public health surveillance in Canada, that stakeholders within the ecosystem can support, and that would enable, as I mentioned earlier, collective and coordinated action across the different environments that conduct surveillance in Canada towards that vision. Next slide, please. And so I'll just close with, how can you get involved? There are a number of activities going on in the next couple of months or next few months, including an online consultation. There'll also be some in-person consultations over the course of the next few months. Many opportunities to get involved. We really encourage you to get involved in any way you can, and we'll have more information available for you in that regard. But we would love to hear from you in terms of your thoughts on what surveillance should look like in the future. And your feedback is very critical, really, to informing where public health surveillance is headed in Canada, and hopefully painting a vision that can be really something that all of us in Canada look towards as we try and improve our surveillance capacity. And I believe next slide with that, I will hand it back to the moderators to manage the discussion. Thank you very much.
Great. Thank you so much, Dr. Buckridge and Dr. Keenan, for both of your very thoughtful and insightful presentations. So as Dr. Buckridge mentioned, this is where we turn the floor over to you, wonderful folks, and that's to basically share your thoughts in terms of what a future of public health surveillance in Canada could and should look like. And we have some questions already posed via the chat. The Q&A pod. So why don't we start with the first question? And as I go through that, I would encourage everyone to share their thoughts in terms of what the future of public health surveillance could look like via the Q&A pod. So our first question comes from one of our attendees, and the question is as follows. So thank you for this excellent presentation. I appreciate that you highlighted the importance of a syndemic approach for surveillance to consider social and structural determinants that must be monitored. My question for the speakers are how to monitor and integrate the collected data, including social and structural determinants of health information, and to combine with modeling projections. So I'm going to actually pass this question to Dr. Keenan to start off, and then following that, perhaps Dr. Buckridge, you can provide your insights as well. So Dr. Keenan, over to you.
Thanks for this question. I wish I had a very simple answer to that question, but it's a very complex topic. But the importance, I think, is to consider collecting some of the social and structural determinants as variables in our surveillance system in order to allow us to do the modeling that is and develop the projections that are as relevant to specific populations, and to understand who is vulnerable and what are the determinants of that vulnerability. And then you can develop a strategy and you can model what would be the projections for specific populations. And you can then enter within that model also the interventions that you're proposing and try to understand what would be the population-specific impact of the intervention. So many examples to that exist. And if we look at, for example, our current STBBI HIV syndemics, the testing for one infectious diseases like syphilis that we're seeing unprecedented numbers, or new infections of HIV, doesn't address the social and structural determinants. And if we based our action on the results just of those diagnostic tests, we're going to miss where to allocate the resources, what's predisposing individuals, what are the social and structural determinants such as houselessness, mental health, etc., that put someone in high risk to begin with. And if we just analyze the cases and wait for traditional contact tracing and identification of, we are not going to make an impact. We're not going to make a dent on the syndemic conditions. So that's why a robust system should have some of those markers of social and structural inequities embedded in the system that will allow us to get a more granular and develop a more accurate action plan that allows to target. I can go on and on with examples of that in waterborne illness, in respiratory infections. We don't know what will be the next respiratory virus that's going to come into the system. Is it COVID, a new generation of COVID, or another respiratory? But we know that who are the populations that are going and the conditions that are going to be affected more. People in long-term care facilities, people in shelters, in congregated settings. So surveillance and identification of some of those social and structural factors will allow us to allocate resources early and accurately to the areas in most need. I think I'll stop here, although there are many other examples that I can go into.
Great, thank you so much. And actually, I'm going to ask the next question to Dr. Buckridge, and this one was heavily voted by participants. So this question comes from Margaret. This isn't the first time we have tried to overcome the challenges of our federated system. So what is different this time around?
Well, so I think it's an important observation that Margaret brings, that we've had a number of reviews about our surveillance activities in the past at different levels of government after different events. And I think it's fair to say that not all of those recommendations have been met. So I understand where Margaret's coming from. At the same time, there's a lot that's changed lately. We've experienced, I think, one of the largest, if not the largest pandemic in modern history. And so, I think it's incumbent upon us to try to understand how we can describe where we want to be. I think we spend a lot of time talking about the problems, and I think that's critical. I think we have to understand where the problems are. But I think, one of the things that we're trying to do differently here is really be looking towards what does that ideal state look like, and not to try and do this each on our own. The public health agencies had a number of strategic activities in the past, but to my knowledge, this is one of the ones where we're taking a really, I would say a very ambitious activity and trying to make sure that we engage broadly with stakeholders in the provinces, in the territories, and Indigenous groups and other stakeholders in surveillance, recognizing the complexity. So, I don't want to oversell in the sense that we're not, just because we create a vision, it's not like we can snap our fingers and make it so. But I do think it's really important that at this really, I think, a pivotal time, a generational opportunity, maybe not to overstate it, to look at where we're at in terms of our surveillance activities as a country, and to paint a clear picture of where we want to get to. With that, particularly, I think if we have support from multiple stakeholders, as I mentioned, it becomes possible to have a bit more of a convergent evolution and to identify what are some of the key priorities. So as an example, the previous question, clearly, as you started, Dr. Keenan, we need to be measuring the concepts that are critical to us. If equity is critical to us, equity across what dimensions, how are we measuring those things? And we need to measure them consistently. We can't be measuring them one way in one part of the country, another way in another part of the country. So we need to not only think about how to measure those, we need to think about measure them in a repeatable way, in a consistent way. And that's not going to happen unless we all agree upon those at some level. So this is one activity that we're talking about, this vision process. So it's not the only activity happening at a federal or provincial or territorial level, but I think it is an important one for us, setting out that yardstick of where we want to get to and describing it, because I would say it's not necessary, it's not sufficient for us to get to where we want to, but I think it is necessary. If we don't have a shared vision of where we want to get to, I think it's going to be very hard for us to make coordinated progress in this country.
Great. Thank you so much for that response, Dr. Buckridge. I think I'm going to take one more question before I pass it back to Louisa. So the final question that we're going to address today comes to us from Curie. In this climate of concern for personal privacy, do you have any suggestions for how to reassure the public when we use non-traditional data sources? And I think, again, this touches upon some of the themes and comments that stemmed from Dr. Buckridge's presentation, as well as Dr. Keenan's. So why don't I pass it over to Dr. Keenan to start, and then we'll end with Dr. Buckridge.
Yeah, another excellent question, and another one with no easy solution. But the part of it is we always have to keep personal privacy and information as a sacred tenet of whatever strategy we develop. And it is important for us to identify ways to disaggregate data enough that we can take good action while not stigmatizing and putting populations or individuals at risk. And that's always a balance of public health between protecting the individual and small population versus protecting public health of the general public. And there are improvements in technological solutions that allow some disaggregation of data and scrambling of the data afterward in the reports that are generated, but with the ability to not disclose information on individual or small community, while allowing for interventions and resources to reach those. Absolutely, that has to be one of the components as we re-envision the surveillance system. It has to take into account the ability to both be granular, but without putting anyone on the spot and generating more vulnerability and more stigma. So it is a challenge, and it has to be one of the things that is on top of mind. Because we want to increase equity, we don't want to increase stigmatization, and don't want to marginalize those who are marginalized even further. So no good single solution, but that has to be one of the key contexts that I'm sure is causing Dr. Buckridge a lot of headache.
So yes, so Dr. Buckridge.
I can take a Tylenol. No, yeah. So no, a great response, and I would just add. I mean, there are, as I think, as you mentioned, technical solutions that can help with this in some way, but and are critical. But I think probably the most important answer is it's really about trust and transparency, and so trust is, I think what we need to establish or reestablish, and the transparency is really about how do we do this, and how do we use the data, and how do we ensure that we're protecting privacy while getting the maximum public good out of the data. And that's the way I like to think about it, is that there are legal, ethical requirements. We want to be very clear about what those are and how we manage the data within those to ensure privacy, not only at the individual level, but avoiding stigmatization of communities, as was mentioned as well, is a really important other perspective on this. But within that, once we have those set, we want to then make sure that people understand there's great value to these data for them and for Canadians in general. And so I think that's the message that we have to give, is that, we want to build that trust, and that trust is going to only be built by some degree of communication and transparency about how the data are treated and why we're doing this in the first place, what the value is and how important it is to do this. And I think that needs to be part of the discussion, but this is really a critical point. And I think it's one, as you mentioned, Dr. Keehan, that does give me headaches, but it needs to be designed into any future. And so often people talk about privacy by design. I think that's really how we need to be thinking about the future of public health surveillance in Canada, is that this future state that we envision has to really have this perspective really as a core component of it.
Great, and thank you both for those very thoughtful responses, and also thank you everyone who participated and shared their questions via the chat. There's a lot of questions, and as we noted earlier on, we wouldn't be able to get to all of them, but we will definitely consider those questions as we look at developing a future vision for public health surveillance in this country. And so on that note, I'm going to pass it over to Louisa, who's going to do a quick wrap up.
Okay, we are nearing the end of today's seminar, and we would like to take this time to thank our speakers, Dr. David and Dr. Joab, for sharing their insights and expertise on where public health surveillance in Canada is today and where it's headed. And of course, thank you all of you for joining us today for the launch of the Surveillance Advances Seminar Series. We hope you enjoyed this seminar. So please take the time to complete our survey for this presentation. You can scan the QR code on this slide to access the survey, and also you will be able to find a link to the survey on an email that we'll share with you shortly. Your feedback is very important to help us to identify any areas of success or improvement for the seminar series. And just remember that if you want, or if you require a letter of participation, you can request one at the end of this survey. The recording for today's seminar and the presentation material will be accessible for viewing on NCCID's website in a few weeks. And if you have more questions about the Surveillance Advances Seminar Series, please visit NCCID website. And just to let you know, our next seminar will be on Tuesday, October 31st, and we will be talking about health inequalities in the context of public health surveillance. And that concludes today's seminar. Thank you everyone for joining, and we hope everyone has a great rest of the week, and see you in October. Thank you.